moment here. Okay. So welcome everyone. This is our most popular, one of our most popular webinars, Potty Training for Children with Special Needs. And we have a really great presenter here. Her name is Aubrey Zaruba. She's a child development specialist leader at Kids on the Move. Many of you might be familiar with Kids on the Move through early intervention or their preschool services or Friday night respite. They also run some really great specialty workshops like SIB shops. So we are so grateful to partner with Kids on the Move. They also provide space for our teen night and young adult programs. And then Aubrey is here to present some really helpful information to help your process and your whole procedure and process of potty training as stress-free as possible and successful as possible. So Aubrey, thank you so much for being here. Thanks for joining us. And I will hand it over to you.
Thank you so much. Thanks for having me again. Some of you may have participated in this presentation in the past, and I will just give you a little heads up. It's the exact same presentation. Obviously, we might have some different questions or conversation, and even if you've heard it before, I'm happy to have you back, and you're obviously more than welcome to be here, even if this is a repeat. I think this is a topic that, especially when you're working with kids with special needs, you sometimes have to give it a few attempts or kind of learn and hear things multiple times. So welcome everybody. I'm glad to be here with you. I am glad that we can do this together. And it's nice, like she mentioned, there will be the recording. So if you need to go back and refer, and then the PowerPoint as well. If you take note on the first slide, my email is right there at the bottom. If you have a question that we don't get to today, or you think of a question next week or anything like that, you're always welcome to reach out to me via email anytime. I'm available. It doesn't have to be just, right after this presentation, or if you're watching the recording down the road, you're welcome to reach out as well. I will just a couple of notes that are a little side notes that, as Sylvia mentioned, at Kids on the Move, we do have a couple of other programs besides our early intervention program. The one that stood out that she mentioned was our SIB shops program. So if you have other children who are ages 7 to 12 who would be interested in a once a month fun class that's special for them, you can email me. I can get you more information. There's information on our website, which is just kidsonthemove.org. And we are always happy to have more kids participate in our SIB shops program. It's one Saturday a month for a couple hours, and they do fun activities. They have a theme, they have a lunch. It's really fun for those siblings. I will just put one more little plug in to mute yourself, just so that we don't have background noise and things. If you have questions, we will have specific questions at the end, but you're welcome to ask a question throughout if you have one. Just unmute yourself when you have your question. All right, we're going to go ahead and get started. Potty training is such a hot topic. Everybody wants to know the best way to potty train and how to make it successful and all those kinds of things. I'm going to get started just kind of letting you know where some of this information comes from. So on our next slide, we just have a few kind of source credits. If we want to bump ahead to our next slide. There we go. A lot of this information that I'm sharing today, these are the sources that I'm gathering my information. A lot of the information actually comes from anecdotal experiences. Potty training I participated in myself, also talking to friends, family. I've been in the field of early intervention, special education sort of things for over 20 years. So I have a little bit of experience. I don't, however, have your experience. So your experience is individual to you and your child, and there may be things that resonate with you and things that do not. But if you're wanting a little more information than what we talked about today, these are a couple spots where you could go for more information. Obviously, the internet is a big daunting place, and there are some really helpful things, and sometimes it is just really overwhelming. So hopefully today we'll have a little bit more concise information to at least get your wheels turning, which I'm sure they're already turning when it comes to potty training. Okay, we'll go to our next slide, and we'll kind of get started with just what I call first things first. Before we talk about specific techniques that we might use, my first step when it comes to potty training is always readiness. And we're going to start out with the parent or caregiver readiness. A lot of times we think about, is the child ready? And we will talk about that. But I want to talk about your readiness first. Do you have the time? What is your life looking like right now? Do you have the patience? How realistic are your expectations? And I think this is one thing that varies or can potentially vary between potty training with special needs and not, is that sometimes we need a little more patience and we need a little more time. And we may have had a couple more participants join us. I'll just put another plug in to mute yourself as you hop on, just so that we can not have background noise. Feel free to unmute if you have any questions or anything. The next one is, are you prepared for child independence? When you are doing a lot of caregiving, sometimes it's nice to think about the day when your child might be more independent. But as most of us know, when that independence starts, it's tricky, because we're longing for the day, but independence doesn't happen overnight. And sometimes there are a lot of messes as kids are becoming more independent. So are you ready for that? And are you set up for success? Do you have the necessary things that you want to use in order to make things successful? Next, we're going to talk on the next slide about child readiness. So our next slide will feature some things that we're looking for in our kids to evaluate and determine, do we think that they are ready? I'm not sure if you're trying to advance the slide and it's just not going quite yet. There might be a little lag. Okay, there we go. I'll go ahead and, oh, it looks like we jumped ahead to, I think we missed, there we go. Sylvia has graciously offered to advance the slides for me, which sometimes means there's just a little bit of, a few little bumps, but it just works. It works out fine. So thank you again for doing that for me. When we're looking at child readiness, we want to look at physical readiness in terms of bladder control. Are they staying dry for several hours, or are you noticing they're frequently wet throughout the day? Are they waking up dry, first of all, after their nap, if they're still napping, or eventually, are they waking up from their long nighttime sleep? Are they waking up dry? Do they acknowledge their wet diaper or their need to urinate? Are they letting you know that they are going, or, sometimes kids will start out by letting you know they went. Like, oh, I have a wet diaper now. We want to look forward to the time when they can let us know that they need to go, as opposed to I just went. But I just went can be a precursor to that. So we want to look at those bladder patterns. We also want to look at their bowel control. Are they having bowel movements on a schedule? Do they stop their play and maybe hide or go to a specific place to have their bowel movement? Again, do they acknowledge that need for a diaper change or their need to have a bowel movement? So these are some, physical signs that our kids might be getting ready to explore that potty training. The next slide that we saw there for a quick minute is not necessarily those physical signs. I think the physical signs are a good place to look at first, because if we're not seeing those things, that's going to tell us we're not quite ready. Then we start to look at some of our other readiness. So their emotional readiness. Are they complaining about kind of their wet or dirty diapers? Is the soiled diaper kind of bothering them? Again, are they anticipating the need to go before it happens? If your child is anticipating the need, or not anticipating, but more after the fact, they're letting you know, again, that's a good step in the right direction. Are they noticing the difference between clean and not clean? If you don't like those words, more the concept, and I'm not just talking about with diapers, but I'm talking about just in general. Are they noticing the difference even on their hands of messy hands versus clean hands? Are they noticing the difference, like on their high chair tray or on their, plate at the table? Is it clean? Is it dirty? So that they can also notice with their diaper. Is your diaper clean? Is your diaper not clean? Again, it doesn't have to be that language if you have other language that suits you better. Do they like to be independent? Are they wanting to do things for themselves? Those are some emotional signs that and this doesn't mean yes, we're ready or no, we're not ready, but I think it is really important to evaluate where are we at kind of on that readiness continuum. The next thing would be that self-care readiness. Are they helping you with dressing and undressing? and to what extent. If you're noticing your child is becoming very interested in helping you kind of with all of the dressing and undressing, pants on, pants off, shirt on, shirt off, shoes, socks, hats, coats, whatever, just in general, those are all good signs. For potty training specifically, we obviously need to pay attention to the pants. Are they able to pull, or bottom, whatever they're wearing on their bottoms, not pants specifically, but just whatever's on the bottom, can they pull it off? Can they pull it on? Are they helping with hand washing? Depending on your child, how big they are, what other skills they have, you may or may not need to be pretty involved with the hand washing for a while. This one is an interesting one that we don't often talk about, but are they drinking from a cup for most of their liquids? Drinking an 8-ounce bottle makes it harder to stay dry. So if we are still using a bottle quite a bit throughout the day, it's going to be harder to stay dry when you kind of down, and some kids get pretty quick. They can kind of down their 8-ounce bottle in, a pretty brief amount of time. So if we're drinking from a cup and we're just having sips here and there, kind of like us as adults, if we, guzzle our whole cup really quickly, we often need to use the restroom pretty quickly. But if we kind of have sips of water throughout the day, and it's not that it's bad to drink a lot at one time, just when we're talking about readiness for potty training before kids have learned really to hold it and things like that. Hopefully that all makes sense. We're going to continue on with child readiness. Communication readiness, I put in bold letters because I think we all understand why that's important. But in order for your child to become potty trained, they need to be able to let you know that they need to go. It's pretty rare, especially when we're potty training with special needs, that we would be able to go from diapers to independently using the bathroom, very quickly. There's probably going to be a process. And so in that process, we need some communication. It does not have to be verbal communication. However, obviously, it can be sign language. It can be picture communication. It can be another gesture that you as a family have decided upon, but your child needs some way to express to you that they need to go. So if you are seeing a few of these readiness signs, but the communication is not there at all, I think that's a great place to start, because we can even communicate when it comes to diaper changes. We can kind of start that communication. So maybe you're thinking, yeah, no way, my child is not ready, but I'm just here because I want to get prepared. That's great. Again, welcome. So happy you're here. But I would suggest kind of starting on that communication. So let's say you've decided you're going to use, and I'm no sign language expert. I know baby sign at best, but we've got the toilet sign. We can kind of use, I use toilet for kind of toilet, potty, bathroom, maybe a little, I'd probably overuse it or over generalize it. But when I go to change their diaper, I might tell them, oh, you went potty, let's change your diaper. And you can do change, you can do diaper, you can use all those other signs. That's totally fine. But I want them to start hearing the word that I'm going to use when I'm going to start my potty training. If you've trained other kids in your family, you might already know what your word is. If this is your first child that you're going to be potty training, I would just go ahead and pick a word. A lot of people like potty. It's from a speech perspective, it's a little easier to say than bathroom or toilet. Some people choose words like pee or poop or things like that. This is a family decision. Anything you choose is fine, but we want to kind of start exposing them to those words and having some consistency with it, so that when we are ready to fully dive into the training, we don't have to teach the communication at that point. If they're not ready, communication wise, they're not going to be ready to be fully trained. It is possible for you to have your child using the toilet on a prompted basis. That to me isn't potty trained, but it is still a good step in the right direction. So if you're thinking, yeah, there's no way my child is going to communicate to me, they're not initiating communication very readily quite yet, that's okay. You can still, expose them to the toilet and things, and you can have them going on a schedule, and, it doesn't mean you can't move forward. Now let's talk about, so communication is both understanding and expressing, right? We all I shouldn't assume what you all know, but I think it's common that a lot of you would know we talk about receptive language and expressive language. So when I say communication readiness and that big, bold top phrase there, I'm talking more expressive, whether it's, again, verbal, sign, gesture, etc., picture. The second is more that receptive language, what we're receiving. So our understanding of language. Do they follow simple directions? So as we think about simple directions that we would need to follow when it comes to potty training, toilet use, things like that, we need to follow the direction to pull our pants down, pull our pants up, sit, stand, flush, get the toilet paper, wipe, dispose of it, however you say that, stand at the sink, wash, just all these, think about these words that we would use. And your child absolutely the best out of anyone. Think about your child and how much step by step are they going to need as you start the training. So some kids are really going to need it broken down. I think we have somebody who's unmuted. If you want to just mute yourself, that'd be great. Thank you. As we start, we may need to break down every little step, and we may not. It's very, very, very individual. Are they imitating simple actions? So we start imitation. Oftentimes imitation starts with either clapping, banging, waving, or all of the above. Other imitation, we kind of do the, so big or different things. Play imitation, we imitate songs, pat a cake, wheels on the bus, those sorts of things. Are they doing that for starters? If they're doing that, then can we start to imitate some actions we need when it comes to potty training? Can we imitate, rubbing our hands together? Can we imitate, getting the soap? Can we imitate flushing? Can we imitate pulling our pants down? Things like that. Understanding the difference between wet and dry, clean and dirty. We kind of already talked about the clean and dirty, wet and dry as well. And you can do that, again, if you're thinking like, we're not ready for potty training yet, but I want to start moving forward. So wet and dry, that's, all the time. Oh, you spilled your water on your shirt. Your shirt's wet. Oh, now it's dry. Or, you're in the tub, you're wet. Let's get your towel and dry you off. Oh, now you're dry. So we're exposing them to the differences between wet and dry so they can feel what it feels like. Diapers are often quite absorbent. So I don't know what it feels like. A lot of us don't really know what a wet diaper feels like. But depending on how wet they are, if they're not very wet, they may not fully notice. I'm not sure. Can they sit for at least 5 minutes? In the beginning, we've got somebody who's unmuted. If you want to just mute yourself, that would be great. Thank you. We want them to be able to sit for at least 5 minutes because sometimes it takes some time for particularly bowel movements. So it's okay if they need a bit of a distraction, in terms of looking at a book or, something like that. And we're not even just talking about sit on the toilet for 5 minutes. We're just talking about, can they sit in play at mealtime, things like that. And do they respond to praise for their accomplishments? That one is they don't have to do it, but it can be nice. We often use praise in order to motivate kids to continue. Some more child readiness, some more communication readiness. So again, back to that expressive communication that we were talking about. Well, we kind of already covered this a little bit. I jumped ahead a little bit, but gestures, signs, pictures, words, something that is specific enough to let you know they need to go. So again, that's something you can start pretty early on. Do they have that specific strategy? What kind of communication are you working on with your child? Whatever that is, we can use that to kind of work on that communication for potty training. Motor readiness is also something to consider. Are they able to walk and stoop down? And how long have they been able to do that? Have they been able to do that for at least 6 months to a year? Think about, and there are some adaptive supports if your child has motor concerns that are going to be long-term concerns. There are, adaptive things that you can talk to an occupational therapist about or other providers that work with your kids. But for kids who have just had a motor delay and they're they're kind of catching up at their own rate. We want to see, you need to have some decent stability to sit on the toilet and be secure on the toilet. Can you, and whether you use a special potty seat or a special potty, I think that's an individual decision. We can touch on that a bit later, but as far as, thinking about sitting on the toilet, can you imagine if you were fairly unstable in walking and maybe even just kind of that trunk strength and things like that, and then you get, sit on this chair that has a big hole in the middle? I can see why kids freak out. So we're looking for some good motor stability. Sometimes it can even be nice to practice sitting on the toilet with the lid down and their clothes on. Just, kind of depending on how your child feels about the toilet. And then are they picking up small objects using kind of that pincer grasp? This just kind of indicates their overall readiness when it comes to their motor development. So, when we're using the toilet, we're not doing a pincer grasp, but we're just kind of evaluating, motor readiness altogether. So we have covered readiness. Now we're going to move into, actually, we've decided we're ready. Now we want to get ready. So our next slide is going to, that we've kind of arrived. We've thought about readiness. I think evaluating readiness is a good continual practice until you've made the decision, yes, we are in fact ready. So no matter where your kids are at right now on the readiness, I think it makes good sense to just kind of look at those readiness factors, even if you're thinking, yeah, my child is nowhere near ready, but I want to at least be thinking about it. I'll just take a peek at those things we just talked about. So let's get ready. Let's get ready to start. These are some suggestions. These, of course, I'm not telling you have to do this. I can't tell you what to do. You're your own person. You get to decide. But these are some suggestions I have for success. Use a chart to track their patterns for about 1 to 2 weeks before starting. I am not very techy. In fact, to make this PowerPoint, I borrowed a PowerPoint that a coworker already did, and I deleted her information and added mine in. That's about my skill level when it comes to technology. So I'm not saying it has to be a fancy chart. I'd probably do it with paper myself because I'm old school. But just track the hours of the day and when diaper changes are happening so that you kind of know, oh yeah, he does have a bowel movement about 1 o'clock every day. Or, yep, I'm noticing about, we change the first diaper first thing in the morning. He's waking up dry basically every day. But then I'm noticing around 10 a.m. we're having wet diapers every day. Those kinds of things. So that you might look at your chart and you might have stuff kind of going all over the place. And you might think, wow, we don't have any patterns. So use your chart, track your, patterns or lack of patterns. And then let's gather our supplies. Let's get ourselves ready so that on the day we decide to start, we're ready to go. I like rewards. I think most people are motivated by rewards. Some smaller rewards and some bigger rewards. These are very individual to your family. Some people like to use treats, stickers, food coloring in the toilet water, a small toy, additional one-on-one time with a parent or caregiver. The list goes on and on. Some people are totally fine with using a food motivator, like a treat of some sort, and other people prefer not to do that. It's a very individual decision. I would suggest if you use a food item that it's very small, a mini M&M, a mini marshmallow, a Smartie. I don't really know why I'm blanking on little treats, but I think you get the point. If we give the child like a fruit snack, not a pack of fruit snacks, that's what I was going to say. If we give them a whole pack of fruit snacks, we may or may not want them having, 6 packs of fruit snacks throughout the day if we're going to try the potty 6 times in the day. I think it's totally fine to mix up the rewards. Maybe one time you get a mini M&M, the next time you get a little food coloring in the toilet, the next time you get a little popper toy that pops a few times. I think it's nice if you're going with the reward system that you have a bit of a bucket that's specific for the potty. We don't play with these things when we're not trying to use the potty. a sticker chart, stickers, a cotton ball jar, a marble jar, something like that. So every time you attempt the potty, you deposit something in. Once your jar is full, then you get a bigger reward. Next would be underwear. You want to have, those already ready to go. Specific potty training underwear, training pants. I can't remember exactly what they're called. I think that those are good to get started with. Pull-ups, I have major question marks beside that because pull-ups are more convenient. They're easy to pull on and off. Obviously, that's the point, but they're not necessarily more helpful. They are still a diaper. The pull-up is sometimes a stepping stone, but sometimes not. I actually sometimes, and it may be covered later on in here, sometimes I skip around. I sometimes like, if we're trying to move to underwear, but we're still having some accidents and we're not catching the concept of wet and things like that, I will recommend underwear and then the pull-up over the top of the underwear. So what happens in that case is the underwear does get soiled. You have to clean up the underwear, but the pull-up catches the rest of the mess. So you're not cleaning up pants, you're not cleaning up carpet, you're not cleaning up, other things. And what it does is it helps the child to realize, or sometimes helps the child to realize, oh, I started to go. I feel my underwear getting wet. I need to hurry to the bathroom. Again, that can be a process, but the point of adding the pull-up on the top is just for your own sake of not having to clean up messes or big messes all the time. But pull-ups are not necessary, and they definitely don't help kids in terms of learning to go. They may help with the pulling down. So I'm not for them. I'm not against them. I'm kind of neutral, but I don't think that they are, I guess saying that I'm neutral is basically my point. A step stool is often necessary for climbing, or, to step up on to wash hands. It can also be nice for your child to put their feet on a step stool if they're sitting on the adult toilet so that their feet aren't just dangling down. That can also help them feel a bit more secure. A potty seat, if you've decided you're going to use that potty seat. Okay, we've gathered up all our supplies. Now our next slide is going to show us some different approaches that we can use. We kind of have a gradual or casual training approach where we're kind of just introducing the toilet here and there. We're sitting on the toilet before bath time. There's no pressure. We're praising success. We're just warming up. This is not going to be the end-all method that's going to get them potty trained, but it can be a good start. The next method is the 3-day method or the flooding method. There may be other names that we've heard as well. It's kind of where you stay home for 3 days. You offer a lot of liquids, make frequent trips to the toilet to catch them when they need to go, so that hopefully all of their output is happening in the toilet rather than in their diaper. Our next slide talks about scheduled training, where we are dressing in pants and underwear, kind of having those backups available. We have the child pull down their pants, pull them up. We sit on the toilet every 30 minutes for at least 2 minutes. A visual timer can be really helpful so kids know how long 2 minutes actually is. We reward them for sitting, and then a big, huge reward with very specific praise. Good job going potty, or good job going pee, or things like that for their success. And then we wash hands. We check their underwear every 5 minutes for an accident or for signs that they need to go. Excuse me. Accidents will happen. We want to have them do as much of the cleanup as possible in the bathroom. Oh, it looks like you went potty. Let's go to the bathroom and change your underwear. Remain very neutral and state the facts. You're wet. Let's go change you. No emotion, which I know easier said than done. No emotion, no punishment, just the fact. You're wet. We need to change. Those methods are, they kind of vary in intensity. Obviously, the scheduled training does require a lot from you. It requires you to be checking them. It kind of requires you to be with them the majority of the time. The 3-day method is kind of 3 intense days, and then the gradual method is just kind of that, casual. I don't think that there's a right and a wrong. I think it depends on, all those readiness factors, including your readiness and what feels best and feels like it might work best for you. Let's move on to kind of talking about, I just referenced emotion with regards to that last method, but I like the phrase empathy overpowers anger. So this is from Love and Logic. The opposite of anger is not calmness, it's empathy. So potty training can be very frustrating, as we all know. Anger and negative emotion do not help at all. Punishment for accidents usually backfires. So in the scheduled training method, when I said that we want them, to clean up in the bathroom or even assist with cleanup, this is not, you made a mess, you have to clean it up because you made a mess. It's more just, you're wet, we need to get you changed. And as part of the process, I'm going to have you help. Punishment really, in general, I'm a bigger fan of reward systems over punishment systems. But when it comes to potty training, usually punishment just creates other problems in terms of kids holding it and things like that. So I don't advise punishment at all when it comes to potty training. Next, I like this quote about empathy. Empathy not only matters, it is the foundation of effective parenting. I think that raising kids now, empathy is a big buzzword that we hear. And it's something that is a primary focus of a lot of people, a lot of therapies in terms of mental health therapy, talk therapy, things like that. We talk a lot about empathy. And when it comes to potty training, I think that it's really important. I can't imagine how frustrating it is for a child to try to become potty trained, especially when they really want to. Think about, us learning a new skill and how challenging it is. Learning to be potty trained feels really challenging. However, there are some tips and tricks. Kind of moving forward to our next slide, I've got a few tips and tricks that can kind of help us out. Number one, stay calm. I know that that's easier said than done as well, but try our best. And that's why I go over that parent caregiver readiness, because maybe we're not in the space to stay calm. So what that tells me is we're also not in the space to potty train quite yet. You are not in control. You probably already know this, but as much as we want to be in control, there are a few things we cannot force our kids to do. We cannot force them to eat. We cannot force them to talk. We cannot force them to potty train. We can encourage, we can motivate, we can try our best, but we cannot force them to do those things. With eating, you can shove food in their mouth and they can spit it back at you. You cannot force them to eat it and swallow it. Same thing with the potty training. We can't make kids toilet train. The more power we try to enforce, the more they might withhold. And we do not want that. That causes medical problems. So we don't want kids to get constipated. We don't want them to have, urinary tract issues because we are forcing it and they're fighting back by withholding. Once you start, give it a little time before giving up. If it's not working, don't be afraid to wait a little longer until everyone is ready. So those last two bullet points I think they go hand in hand, even though they feel maybe a little contradictory. I think it really depends. I had a friend recently who she attempted to potty train her daughter, and her daughter doesn't have any special needs or anything. She was just, showing signs of readiness. And she attempted, and the first day was a nightmare for the whole family. And mom, dad, I guess mom and dad, ultimately child, all decided, nope, we're going to pause. It only took them that one day to decide we're not ready yet. None of us are ready yet. They waited, tried again a few months later, and she potty trained herself. When we're talking about potty training with special needs, I think we don't always get quite as drastic of a success story. Sometimes it requires more from us, but I do think that when kids are truly ready, it goes much better. If you find yourself in a power struggle, get out. It is not worth it. I always say parenting is just all day long picking your battles. Don't struggle over potty training. You're going to lose, first of all. Like I said, you can't really win, and it's not worth it, and it's not fun. It's miserable to fight kids, particularly on potty training. Offer them choices. Sometimes when kids are really in the power struggle, I will just ask them, do you want to try the potty? And if they say no, I say, okay, we'll try later. So they know you really do have control over this. Which is my second point. Let them have control. They want control. They're looking for control. Just go ahead and give it to them. And then kind of take a step back. If you're having a lot of power struggles, you're forcing, let's say you've tried the scheduled method and you're taking them to the potty every 30 minutes and you're checking them every 5 minutes. And every time you go to check their diaper, they start to, get upset with you, flail around, maybe whack you. Maybe just step back and say, okay, maybe every 5 minutes is too much. I'm going to check you. I'm going to let you like skip this check time, or I'm going to check you every 7 minutes instead, or something, things like that. We have a few more tips and tricks coming up on our next slide. We talked a bit about the pull-ups already. On their own, pull-ups feel like diapers. So again, I'm pretty neutral on pull-ups, probably neutral to pro pull-up with the underwear. I do advise that a bit. Daytime training may occur long before nighttime training is mastered, and that is okay. If your child can wear underwear and be totally trained during the day, yet they need a diaper or something at nighttime, totally okay. Fade out your rewards as you can. Remember to reward staying dry. We don't want to be giving kids mini M&Ms for 5 years, right? But we'll use them as we need them. Boys can sit or stand. If they're standing, sometimes a Cheerio can be a target to try to help them make it in the toilet as opposed to everywhere else in your bathroom. Some boys prefer to sit. Some parents prefer for boys to sit. Sometimes sitting backwards, especially for little boys, but either boys or girls, can be nice to kind of keep things contained into the toilet, again, instead of all over the place. Sitting backwards also kind of allows them to hug the tank a little bit if they need a little bit of extra support with their stability. So that's a tip that is kind of just, again, individual. We have some more tips and tricks. Accidents are probable. Handle with minimal emotion and move on. Again, just kind of stating the facts. Oh, you're wet. Let's change you. It can be tempting to get frustrated because it is frustrating. But the more neutral we can remain, the more the child will also remain neutral about potty training. If we're very emotional, they likely will be too, because we feed off each other. Keep it positive as much as possible. Positive reinforcement, positive talk, all that. If flushing is scary, teach them that it is safe and okay to flush. That's kind of individual. There's certainly kids who are scared to flush, and there are other kids who think it's the best thing ever. So you may need to practice when it's not potty time. If they have been in the past, they've been scared of the flushing. Use a visual schedule if necessary. Pull pants down, sit on toilet, use the toilet paper, flush, pants up, wash hands. That will kind of help with the sequence if needed. We don't necessarily need it, but we can use it if we want to. Sometimes we do need to do a little data tracking just to kind of see, again, what are their patterns? How often are they having accidents? If your child is having a lot of accidents, we may not be quite ready yet. We may need to kind of reevaluate that. All right, let's kind of talk about some key takeaways, and then we'll have a little bit of time for questions. My first takeaway, I guess, that I want you to take away is make sure everyone is ready. Everyone that we talked about in the beginning. Prepare before you start. Set yourself up for success. Give yourself adequate time. If this is a time in your life where you're feeling very busy, very stressed, running from here to there, that may not be the ideal time to potty train. If you're feeling a little lull in your schedule and you're seeing those readiness signs, that might be a good time to think about it. Remain calm and positive as much as possible. A lot of what I'm telling you is the ideal. I know life isn't always ideal, and I know sometimes we lose it on our kids, and that's okay. We can just apologize and move on. That's what happens when we, lose our patience. Celebrate their success, whatever that is. Some kids may need to celebrate just sitting on the toilet. We can celebrate sitting. We can celebrate being successful at going in the toilet. We can celebrate staying dry, lots of things to celebrate. It can be a small celebration, it doesn't have to be a big, huge celebration. We have, I will say that I do need to be done right about 11. I have another appointment I need to get to, but that does leave us a sufficient amount of time here for questions. And like I mentioned in the beginning, you're welcome to reach out if you don't get your question answered today or don't get a chance to ask or anything. I'm happy to chat more. If you are still involved with early intervention, your early intervention provider can also be a great resource for you. If your child's beyond early intervention, they have preschool teachers, things like that. That can also be helpful. And you as parents are really, your best resources are each other. And that's one thing I love so much about the United Angels, is that you are such a great parent to parent resource, which I think is our, your top resource. So anybody have any questions? Is there a way to get the slides? That is actually a great question. If you email me, I can send them, or I'm not sure if Sylvia has a way to get them to you.
I can send them out.
Okay.
Yeah,
awesome.
I'd be happy to send them out if that's okay. I can send those out with the recording later today.
Okay. Yeah, that totally works. You're welcome to do that. Seems like some people, okay, I'm going to turn the chat on so I can see.
Aubrey, I have a question from a parent who was not able to attend live. She emailed me a few. She wants to know, how do we handle regression when it starts to happen once you've already been potty training and you have regression happen? Where do you start back in the process? Do you start from the beginning? Do you go back one step? What's the best advice?
That is actually a really good question. My first thought with that would be to kind of evaluate what's going on in the environment, in the home, in the family, and maybe try to identify the reason for the regression, and then kind of go from there. If there's been some other developmental regression, it would make sense that there would be some regression with the potty training as well. If maybe there's life circumstances, then, I might kind of evaluate. And if I had the chance to talk one-on-one with this parent, I would kind of ask some more questions in terms of, what's going on. But just generally, I would try and evaluate where the breakdown is in the process. And if it feels like there's kind of a total breakdown, then I might start back over. If it kind of is just, maybe they're still capable of going, they're just not initiating, then I might kind of start in the initiation phase, where I would try and do some sometimes words are hard. I'm struggling. I don't know. But I would try and just give a little, I guess maybe a little more robust praise for if the child does initiate, if we're at that step. So I would try to just beef up whatever step we're kind of regressing on. That's a great question. Definitely some sub questions there.
She said when her son started kindergarten, the school schedule was a little bit different. Is there anything she can do to work with the schools? That's something that could be written into an IEP, that he gets breaks at certain times to help with that?
I think so. I'm not 100% familiar. I mean, we transition kids from early intervention into the school system. And I think that a lot of accommodations can be made when there is an IEP or 504 in place. And so I certainly would talk with the teacher and see what kinds of things can be addressed. I would assume that teachers would also want kids to be successful with their potty training. So hopefully they would be able to come up with, a compromise that would work.
Will poop on the potty, but won't pee. Already getting line before us.
Okay, let's see. We've got a few questions here in the chat. Let me scroll back up to the top here. And I'll get to your question in just a minute. This one seems like the opposite. We're doing great with the pee training, but won't poop in the potty. Trying to make it positive and praise any progress, but really struggling. I bet there's some other people here in your same situation, whether they're here live with us today or watching the recording. Super common to be able to have success with pee, but not poop. We really have to be careful with it, which you probably already know, that we're not inadvertently causing the child to withhold going. This is not an answer that probably anyone's going to like, but if the child will only poop in their diaper, I kind of give them that control. Like, when you need to poop, you can wear your diaper. You need to, either go in the bathroom with your diaper, or, kind of try to maybe some baby steps. Of course, we would love it if we could just say, you need to go in the toilet. That's where we go. But that sometimes will lead to withholding that causes constipation that then impacts all the other areas of development. I am very pro take it at your child's pace, which I know can be so frustrating, because if they're, really successful with going pee in the toilet, it feels like you could be fully potty trained. Why don't you just do all of your bathroom business in the toilet? So that would be my recommendation, is to kind of just follow their lead a little bit with it, which I feel is probably not the answer that you're hoping for. Okay, let's see. This next one here. Your son will go if you remind him, but he's only had a few times where he's told you. If you forget to remind him, he'll have an accident. He feels upset when that happens. Is it best to just work on trying to remind him? Any other tips? Excellent question. I know that they have a few different things I've seen. I'm not super familiar with the products, but I've seen them before, like a watch that will kind of go off on a certain increment to kind of remind them to go. I think you reminding him is great. That's a great step. It sounds like it works most of the time, unless you forget to remind him. So I might consider seeing if we could set up some reminders that kind of recur without you having to remember, whether that's, like I said, a watch that he can wear, some sort of visual timer that goes off in the house. If you have Alexa, Google Home, something like that would go off. Maybe trying to take advantage of some sort of technology that would remind him to go, so that it's not completely on you to remember. If you don't have access to any of those things, potentially setting reminders in, your phone or, your device to kind of remind you to remind him. But ultimately, it would be nice if he was able to kind of manage those reminders a little bit until he does get completely independent with it, where he doesn't need those reminders. Our next question, and I wish we had time together today to me answer your question, and then we could go back and forth on it. Unfortunately, we don't have that time right now, but again, you're welcome to reach out individually. The next question is, your daughter will poop in the potty, but she won't go pee. Any ideas to get her to pee? This is kind of the opposite question that we had a couple questions ago. I guess my first, question / advice would be to make sure she has plenty of liquid, so she needs to go. I haven't really encountered this very often, where it's the other way. Usually I see the other way around. How often does she have a wet diaper? And I'm not sure if you're in a position to answer. 4 times a day. Okay. So the other thing I would kind of think on is how often we're trying to get her to go. So, I talked about the scheduling method and sitting on the potty every 30 minutes. And if she's only having 4 wet diapers a day, that's obviously not every 30 minutes is she needing to go. Kind of looking at her schedule, and maybe kind of, how I talked about the scheduling. It's a little harder with a wet diaper to know precisely when they went. If you were to put her in underwear, would she eventually just go in her underwear? Probably. Okay. I'm wondering too how, what her schedule is like in terms of, is she usually wet at about the same times each day to where we could kind of sit her on the potty at those times, give her, some juice, a full sippy cup, a cup, whatever the case is, shortly before her kind of scheduled time. I think people's, urination schedule isn't quite as much as bowel movement. So I think it's a little trickier to predict a schedule, but that would probably be my first. She wakes up dry. She usually goes right before lunch. Okay. And then that's a little tricky too, because you don't necessarily want to load her up on liquids right before lunch, because then she might not be interested in eating lunch because she's full of liquid. This is a really good question. Does anyone else have any suggestions? I honestly have not encountered this. I will say I only work with kids until they're 3 in early intervention. And so the majority of the kids I'm working with aren't actually potty training yet. Everybody wants to talk about it, but most people aren't quite ready. So I haven't really encountered this, but I'm sure other people have. So I'm going to throw it out to the group while we move on to the next question. If anybody has any thoughts on, ways to encourage her to go pee in the toilet, that'd be great. Again, can't reiterate enough how you're welcome to email me and we can brainstorm. I can also ask, coworkers if anybody has any thoughts. Your daughter is autistic and 4.5. She can do everything associated with going to the bathroom. Been going every 30 minutes. She's happy with her potty experience. She just hasn't had any luck actually relieving herself. Okay. You've tried any advice to have her become successful? On this one, my first question would be, have you talked to the doctor about, is there anything potentially going on? I have no idea. I'm certainly not insinuating that there is. I would just be curious, especially where she's having a lot of success with just participating in, the routine and things like that. Another thought.
Her pediatrician says that she's fine. So
Okay. So nothing medical that would be preventing her.
No.
How long does she sit on the potty?
We have tried different time lengths. So we have RBT technicians that come with her 5 days a week, and they'll sit with her on the potty sometimes 5-10 minutes. And she just doesn't go.
Okay. I would maybe try bumping up your time 15-20 minutes even. She can look at a book, she can play with a toy, she can sing songs, she doesn't have to just sit there and stare at the wall. That's a long time. Another thing, you may have already tried this, is kind of pouring a little bit of warm water.
She hates that. We tried it.
She hates it. Okay. Yeah. Okay. That will often get kids, that will often kind of stimulate that need to go, and it will cause them to go.
Yeah, we tried turning on the faucet to have the water sounds. We tried pouring water on her, but she won't let us pour water on her. She doesn't like that. Yeah. So.
What about pouring water on herself? Has she ever had control of the water?
Yes, we give it to her in a little kid's cup, and about this big, and she'll just spread her legs and pour it into the potty herself.
She won't touch her.
No.
Okay, totally understandable. I mean, it is a bit of a weird sensation, and I can see that. I would say my next kind of advice would be to just increase the time that she's sitting.
Okay.
It's hard to say whether or not once she starts having success, if it'll click for her and she'll be able to continue to be successful. That would be everyone's hope, of course.
That's what we feel.
Be my hope. Yeah. So I would increase the time that she's sitting there. Okay. If at some point she expresses in, whatever way she's communicating that she's done, she doesn't want to sit there anymore, I would probably go ahead and let her have that choice, just again, so it doesn't turn into a battle. But I would say 30 minutes, and this is not a hard and fast 30 minutes is the, cutoff, but my guess is about 30 minutes is probably the longest we should sit there. And again, kind of that, having lots of liquid, I'm sure you tried all that stuff, but, and if she's gone in her diaper, I would hold off a while until we try, because if she's just gone in her diaper, she's probably not going to need to go again soon. That sort of thing. Okay, next we have suggestions to familiarize if they're not ready yet, but you're wanting to expose. I love this question because I think this is super applicable to a lot of people, especially in my work with kids under 3. So sitting on the potty, working on that communication, depending on your family dynamic, some people are very open and kids are in the bathroom with parents, often parents, siblings. Other people really kind of try to keep that privacy. There's no right or wrong. If your family is more open and your child is frequently with you, just kind of sharing what's happening. Mommy's going potty, daddy's going potty. I'm gonna use the toilet paper. I'm gonna flush, whatever, words that you typically use in your family, things like that. And then again, like I said, that communication, using the communication when you're changing the diaper, going ahead and deciding what are we gonna call it when we are ready to potty train. Let's start using some of those words. The next question about success, loading her with liquids and things, she's not peeing. I feel like we kind of addressed it a little bit, maybe not quite to the extent you were hoping for, but we are kind of running short on time here. Again, maybe sitting there for a bit longer, making sure that it's been a while since she's gone and things like that. Sounds like we're going to try the underwear with the pull-ups. I have seen some kids really catch on with that. Again, there's none of these ideas are end all be all solutions to everything. But they are some tips to try. Let's see. We had success getting our son to start going in the toilet when we let him watch us go and cheered and congratulated ourselves. Yeah, I think that's actually a really great suggestion as well. Again, if you're if you're a family that does kind of have a little bit more openness with bathroom and things like that, I think that can be, can be really helpful. So, unfortunately, we are out of time. I would love to be able to spend more time, and we've been kind of doing this on a yearly basis. I think that generally your trainings are about an hour in general, but next time I schedule, I'll make sure to give myself at least a few minutes buffer that I could hang around on the Zoom. And like I said, unfortunately today I do have to go, but thank you so much for your questions and your participation. It's a pleasure to be here every year and go through this training with you. And I am grateful for the opportunity. And I, again, really love United Angels. So
let's go.
Thank you for having me.
Thank you so much, Aubrey. We appreciate your help today. Thank you so much. And thanks everyone for coming. Have a great rest of your day.
See ya.
Bye. Thank you.